In healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share our nursing perspective without taking up too much of your time. Today, we're going to delve into hair loss for men. This is a fun episode. I want to say this is our third time addressing like a dermatology topic. So make sure you go back and watch our video on how to find a black dermatologist. That's one of our most popular videos. And then this summer we sat down with Tanja Johnson, the founder of Beautifully Unblemished, which is a support group for people with vitiligo. Today we'll learn about hair loss, the definition, risk factors, symptoms, the different types, how you're going to get diagnosed, what to expect for treatment options, complications, as well as long-term maintenance. If you're new here, welcome to the Melanin Initiative. My name is Dr. Kimberly Madison. I'm a doctorally prepared nurse practitioner and one of your co-hosts here at the Melanin Initiative, along with Alicia and Geraldine. We're a health literacy podcast offering our nursing perspective. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and then to use it to manage your health and advocate for others. It's our hope that by watching on YouTube, LinkedIn, or listening on your favorite podcast app, that you'll be empowered to ask questions, educated on how you can manage your health, and confident to navigate the healthcare system. If you haven't already, we invite you to subscribe, clicking the button, thumbs up, all 5 stars, the notification bell, whether you're on YouTube, on LinkedIn, you can connect with us on your podcast app. We really hope that you will leave us a 5-star and leave a comment or 2. It really helps you support us, and it lets the algorithm know that when people like you look for information like this, that it's really important, and it will show up higher on the search results. Remember, this show is for educational purposes only. The opinions expressed here are opinions alone. They are not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical guidance from your healthcare provider. If you're having a physical emergency, you should call 911. If you or someone you know might be having a mental health emergency, you can call 988 or you can text 741-741. That is a crisis line, so only use it in the event of a crisis. Don't abuse the system. It's there for people who need it when they need it. Okay, ladies, let's get started. Do you have any personal experiences with hair loss?
I don't. No, I don't.
Not personally, no.
Not personally.
Yeah, I don't either, but you know what? I think our community does, and that's one of the things I love. This is one of my favorite topics in dermatology is hair loss, because it does impact our life so much. A lot of times, because of cultural practices or popular ways to style or adorn ourselves, unfortunately, we experience hair loss. And so it's my favorite topic, not because I like to see people experience it, but to provide education and awareness, so hopefully we can avoid that and adopt healthy hair practices. We've devoted a few shows to men's health, right? We're really excited we can bring forward those, so make sure you go back and watch our men's health episodes. We talk about testosterone a lot, and so we're excited to get into hair loss in hopes that we can provide education and awareness and let you know your treatment options, because most of the time treatment options are more plentiful if you get treated early.
Right.
Alrighty, thanks, Kimberly. So as you guys know, we always start off on the Melanin Initiative with a definition. So hair loss, or you also may know it as alopecia, in men or women really, is primarily refers to the thinning or complete loss of hair from the scalp. You'll be able to see, or hopefully you'll be able to see a picture on the screen of just different stages of hair loss or alopecia. So that's available for you to view. But the most common type is androgenetic alopecia, which also is known as male pattern baldness, as seen as the image on the screen, characterized by a receding hairline and thinning at the crown, which is that top part of that head up there. From an anatomy and physiology perspective, let's talk about what hair is and how it serves the body. So hair serves many functions. It's a protection against chemical and physical damage. It insulates against heat loss, water loss, and overheating. It helps with the spread of sweat and oil secretions. And it plays a role in society with our appearance, how we feel about ourselves, and how others perceive us. So there are about 5 million hair follicles covering the human body at birth. So you're born with a lot of hair. The distribution of those hair follicles are determined before birth. In a normal scalp, 90 to 95% of hairs are in the growth phase, while 5 to 10% are in the resting phase. On average, we shed 50 to 100 to 150 hairs per day, and that's normal expectation.
And we don't expect you to count the individual hair. What we do expect you to do is just be observant,
Right.
you know, of what's happening on a daily basis when you do certain types of hairstyles. So if normally, you know, you comb your hair and maybe there's just a few pieces there and you're fine. But then sometimes it's a whole lot more. Maybe it's on your pillow, or it's on your shirt, or you just go like that, right? Those are kind of the things that would likely encourage you to schedule an appointment. And that appointment could be with actually... There's a lot of people these days with the wellness space really booming. So that can be your primary doctor. It might be the first time it comes up. So that could be your physician in PPA. And then depending on what kind of hair loss you have, you might get referred to a dermatology provider, MD in PPA. You might end up at a wellness space or a med spa, depending on what, you know, who's there and what education and training they've received. They might be able to offer that for you. Pediatrician, right? Depending on your age.
More than likely, though, I think hair loss is so specific that a general practitioner probably won't be managing.
They might start you.
They may start you,
but I think a long time to get an appointment.
Yes, but I think, you know, probably more specific, you're going to end up seeing one of the specialists that Kimberly just mentioned.
Because even in my practice, we're limited on where I currently work, but we do have guidelines to at least
get you started,
whether that's over the counter or prescription medication.
Right.
And especially if the prescription that first one works out.
Hey, you don't need a specialist at that point.
But those are some options that you might come across. So let's talk about the different stages of hair growth, because when you do have that appointment, you're going to hear this information to try to help you understand what you're experiencing and where the abnormality lies. So we have 3 growth phases. We have the anagen, that's your growth phase, and that varies depending on where that hair is on the body. And so I think it's no surprise that on the scalp, it's anywhere from 2 to 8 years. I've been growing my locks, since 2017.
Wow, yeah.
And so naturally, this hair is going to be a lot longer than the hair on the eyebrow, which is 2 to 3 months. Then we have catagen, which is programmed cell death. So there's just a time when your DNA says this hair strand should stop growing. And then it will enter the resting phase. And that can last anywhere to 2 to 3 months before it starts over. And you lose old hairs through the shedding of the follicle, which is right there at the scalp, that kind of insertion point when you're doing your typical hair maintenance. Growth is going to be regulated by several hormones, including estrogen, which I don't think we have gotten into estrogen actually on this show, so make sure you go back and check that out. Glucocorticoids, retinoids, thyroid hormones, that's a common one people will come and ask us about. Prolactin and growth hormones. So there's some common hair loss that we see. We might start you off real simple, and then when it doesn't resolve or it's more complicated, you're going to have a much longer visit. It's going to be a lot more testing, because you can have multiple types of hair loss, multiple reasons that are going to be attributing to it, from hormones to stress to side effects of your medications to genetics. So it can be, we request your patience, because it can take a while to get to the right answer, but we want to get to the right answer so we can get to the right treatment. And then we can offer you some medications like finasteride, dutasteride, and minoxidil. Rogaine, very popular one.
Right.
And then we do see differences based on ethnicities. The data shows, though, there's no difference when it comes to the protein structure of the hair. When it comes to Asians, they tend to have more lipid or fatty concentrations within the hair. We do see differences when it comes to the shape of the hair, so straight, wavy, curly, coily. The density and the appearance. Density can be like how full the hair looks, because there might be more follicles than someone else might have. And then the differences in how it responds to different stressors, water, heat, sun damage, things like that. We have different ways we describe hair loss. So we have scarring. versus non-scarring, pattern versus non-pattern, which we saw in the picture earlier, hopefully, and then diffused or circumcised or isolated to specific areas, which we're going to get into more detail. But I think the takeaway from this episode is that non-scarring is typically reversible, and scarring is not. And so that's really where we want our emphasis to go, because on the scarring one, the earlier you get seen, the better we have a chance of trying to slow it down. Even if we can't reverse it, at least we can try to slow it down.
Right.
Hi, I'm Alicia from the Melanin Initiative podcast. Our mission is twofold. One, to simplify complex health information so you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. And two, to elevate the expertise of nurses, spotlight the diverse career opportunities within the healthcare industry, and inform our peers how to leverage their expertise as clinicians and entrepreneurs. In less than 2 years, we've grown to over 50,000 views and 1,000 downloads, with an international audience spanning the US, Canada, the UK, Australia, and more. Our engaged listeners are professionals, entrepreneurs aged 25 to 44 who value authentic, impactful content. Want to connect with this dynamic audience? Advertise with us. Send in your 1-minute video ad and let's amplify your brand. Email tmi.melanin@gmail.com for rates and details. Let's work together.
And as far as risk factors are concerned, risk factors for hair loss in men include genetics. So having a family history of baldness significantly increases your risk for hair loss. Age is another risk factor, so hair loss becomes more common with age. Hormonal changes, androgens, which is a hormone in the body, play a crucial role in hair loss. Medical conditions, certain illnesses and conditions like thyroid disease, scalp infections, and alopecia areata. Yeah. Medications can also contribute to hair loss. So drugs that are used for cancer, for example, arthritis, depression, heart problems, and high blood pressure. Some side effects of some of those meds can be hair loss. So always talk to your provider, because once again, there's different options for medications as it relates to dealing when you're treating certain conditions. So if you're losing hair and it's definitely affecting you, your provider may be able to put you on something else. So always speak to your provider, your healthcare provider. Stress is another risk factor for hair loss. So physical or emotional stress can actually trigger hair loss. And then poor nutrition, lack of essential nutrients can contribute to hair loss as well.
So speaking of nutrients, we're going to talk about lifestyle and diet. So when it comes to diet, really the best thing you can do is have a diet that's rich in micro and macronutrients. That just means eat across the rainbow. You want your plate to look as colorful as possible. If it's all one color, mashed potatoes, chicken is brown, turkey is brown, gravy is brown, the hash browns are brown, the dipping sauce is brown. Right? So I don't expect you to be an expert in nutrition, but I do expect you to use your eyes. Use some purple cabbage, some red tomatoes, some orange carrots, lots of greens, green. I think that is probably the easiest way to go about nutrition,
right.
And to just make sure you're getting a variety. It doesn't have to be in one day, although juicing and smoothies will help make that a lot easier, as well as bowls. I love a vegetable bowl, like boom, 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 boom. Salads can get you there, but I know everybody's not a fan of salads. But yeah, I think I'm a big proponent of juicing and smoothies. And then high in protein. So whether you eat animal protein or plant-based protein, just make sure you're getting it. You're getting it in. And then lifestyle.
Just go ahead and say it.
Smoking doesn't help anything. You know why? Because the smoking competes for oxygen on your cells, and your cells need oxygen to live and thrive. We still haven't done the smoking cessation. So yeah, when we recap, we need to do that. That needs to be at the top of the list.
Yes.
Reducing the stress we talked about, and not just like your physical body, but even just like, if I'm studying for a long period and then I do this and I keep doing this and I keep doing that, and it's not, sometimes you don't even know. It's like biting your nails, right? You don't even know you're doing it. But if you're experiencing hair loss, you might want to be more observant of the little things you're doing, the pulling, the back, the brushing, the this, the that, the and then regular physical activity. That's just going to promote circulation. Circulation is such a big deal. You need blood flow. which sounds obvious, but you'd be surprised.
Right. So what happens when you are not experiencing those things and you start to have some symptoms? So what you may start to notice is a gradual thinning on the top of the head. Yes.
The crown.
Circular or patchy bald spots. A sudden loosening of the hair. So it may not have completely fallen out, but it may be, you notice it looks thinner and it's on its way of falling out. A full body hair loss, and that could be potentially due to medical treatments, and patches of scaling, which could be indicative of ringworm, which we probably won't get too much into today, but
yeah, that's a good point. Even though you're coming in for hair loss, you might end up finding that it's actually something else just based on the appearance.
Right.
So we're going to go through, like, there's a long list of different types of hair loss. I'm just going to go through the list, and then in future episodes we'll go into each one individually. So this first list is the non-scarring or the typically reversible kind. So we have the male pattern hair loss or androgenetic. That's just your typical male pattern loss that we showed earlier. Telogen effluvium, alopecia areata, very common one. Trichotillomania associated with psych diagnoses or mental health concerns. Post-operative, after you've had a procedure. Drug-induced, related to a medication you might be taking. Secondary to syphilis. Psoriasis. I actually just met someone who has that. Yeah, secondary scarring, and then we have and then secondary scarring alopecia, which might be related to burns, radiation, cancer, sarcoidosis, infection, to name a few. And then this can become permanent if it becomes chronic, severe, and untreated. So the scarring kinds, these two kind of my favorite, just because, again, it impacts communities of color, and I want to bring more awareness to it. So the first one is central centrifugal cicatricial alopecia, or CCCA. It predominantly impacts black women in their 30s or 40s. And by that time, the damage is already done. Wow. And the damage that we see is indicative that it probably started in adolescence or when you're a teenager. And the reason I love to bring that up is because nobody's looking for hair loss in teenagers.
Nope.
And by the time these people, 30, 40, they're still very young. They're still out here dating and youthful. And to think, like, I have this hair loss that is no longer treatable is devastating.
Right.
And it starts in the center of the scalp. And so it can, if you do have that dense hair or really thick hair,
you won't notice it.
You might not even notice it. And so it's so important that women know, their moms, their stylists, anyone who has that kind of contact, someone sleeping next to you on the pillow, all of us need to know this information. And so I just love to talk about it. Lichen planopilaris has a similar pattern, and so that would be another what we call differential, or another diagnosis that your provider will rule out or evaluate to see if that's your cause. Frontal fibrosing alopecia. So this one is becoming on the rise, and they're saying that it might be associated with sunscreen. And so I've heard some experts say to even avoid putting it on your eyebrows.
Really?
Graham-Little syndrome, discoid lupus, it severely impacts black and brown communities. Acne keloidalis nuchae, love talking about this one, because I think when growing up I didn't know what it was, but we all seen it. Typically favors young black men in the back of the head or the crown of the scalp. Smooth papules, so smooth little bumps that you typically associate with getting their hair cut, and it can get thick, and you can have redness, you have the hair loss, it looks really irritated. You might have drainage coming from there, and then while they might start off small, they might kind of form together, and that's where you kind of get all that thickening. It is treatable, and so that's the main thing we want people to know. Like, go in and get treated. It's really important for stylists, barbers to know this information. We have dissecting cellulitis, folliculitis, Delcalvans, and traction alopecia, which I think most people have learned about through Naomi Campbell. There's like a picture going around on the internet where you see like her tracks like pretty far back, and there's no hair here. But it's not just her, like it's our community, because of the styles that are so pretty, those beautiful tight buns. Even if you're in the military people, they're very limited on their styles and how they have to wear their hair. So they're definitely at high risk for something like that. Our dancers, our athletes, pulling their hair, our healthcare surgeons, we're always putting our hair back.
Would that also be associated with like wearing headbands?
Even your bonnet, if it has that elastic and it sits right there, especially if that edge is thin or dry. Yeah.
And then women that wear wigs as well.
Huge. Yeah. The wigs, the weaves, the braids, the glue.
The glue.
Yeah, that whole idea of like, I can catch the littlest one and get those. It looks beautiful.
Right.
It really does.
You look great.
But the long-term implications of that, the pulling happening where it take Tylenol, I think we've all been there.
When the braids are
Tylenol, you get those little
bumps.
Yeah, the little bumps, we call papules, they'll pop up, and so you've seen it. I know you've seen it. So let's talk about diagnoses.
So diagnosis involves obtaining medical history, so discussing family history and personal history with your healthcare provider. Your healthcare provider would also do a physical exam where they're checking the pattern for hair loss, also checking to see if you have any of the other symptoms that Kimberly mentioned, like the little papules and certain areas. Also, diagnosis can involve a scalp biopsy where they examine the scalp for skin conditions and they remove a sample piece of the skin for further testing. Blood tests are also part of the diagnosis process where the blood tests identify underlying health issues like thyroid or hormonal imbalances, like thyroid disease or hormonal imbalances. And then the pool test is a test where gently pulls the hair to see how much strands come out. As far as treatment, the good thing is there's a lot of treatment options for hair loss. Medications is usually kind of what we start off with. Minoxidil or Rogaine is a very popular medication. It's an over-the-counter topical treatment that you can find in your typical drugstores. Finasteride or Propecia is a prescription oral medication, so you will need to see your healthcare provider to be prescribed this medication. And Nutrafol is a supplement that's available over the counter and the most recommended supplement by dermatologists. So once again, you have options. Another thing that you can consider or talk to your healthcare provider about is steroid injections. So corticosteroid medications are used to treat people with alopecia areata, lichen planopilaris.
Lichen planopilaris. They're going to be dermatology enthusiasts.
Right.
Episode is over.
Because some of these terms. And discoid lupus erythematosus. So the steroid injection is injected into the scalp. Treatments can take place every 4 to 6 weeks, and you may see hair regrowth in 1 to 2 months. There are also surgical options. So there's hair transplant surgery, and we're actually going to go more in depth in one of our other episodes where we talk about hair restoration, but just a little intro, which I would say. Hair transplant surgery is another treatment option. So this basically moves the hair follicles from one part of the body to the balding areas. Scalp reduction is another procedure where they remove bald scalp and covering with hair bearing scalp. And then laser therapy, which is low level laser therapy is used to stimulate hair growth. Once again, we're going to go more in depth in our future episode.
All right, so with anything, some of these medications can have some complications. So for minoxidil, and that's the topical Rogaine, that can cause some scalp irritation or unwanted facial growth if you put it on the wrong spot. So finasteride can have some complications of some sexual side effects, and it can also increase your risk of prostate cancer. For the steroid injections, it can lead to scalp irritation that may lead to a rash, thinning skin on the scalp, and a red or puffy face, which is kind of a side effect of any steroid. Corticosteroid medication taken by mouth may make the body's immune system less capable of fighting a bacterial or viral infection. For your surgical procedures, a complication could be infection, scarring, or an unnatural looking new hair growth. And then some contraindications could include, or things that would preclude you from even getting the treatment, are that some treatments may not be suitable for men with certain health conditions.
Good point. I wanted to point out minoxidil is available by pill, and most people are able to maintain a treatment when it's just a pill, as opposed to having to put it on their scalp multiple times. When it comes to hair loss, just like the visit and getting to the diagnosis takes time, so does seeing results. So you do have to be very, very patient. And then while people may start to see results 6-12 months, if you stop the medication, unfortunately, it usually leads, you might not, you will lose hair, but it might not, it will just get you back to where you started when you started the treatment. And then with the steroids, because you're giving a steroid, whatever case, pill, injection, topical, you're stopping your body from attacking something or responding. And so the longer you stop your body from being able to attack or respond to like a foreign object or your own body's response, then it limits your body when it does see something that you need its protection.
Right.
And so that's, you're going to see providers be very cautious about the length of time you're given a steroid, how often, how frequent. Yes, it works, and as some of it's available over the counter, and so people have been taking it for decades, and then you come ask for a prescription dose and you wonder why we are cautious in doing that, and that's a big part of the reason why. And we have a lot of non-steroidal medications that do the same, have the same properties without the same risk. So just talk about it. That's hopefully we've given you the language to feel encouraged and empowered to talk about it. So for long-term maintenance and follow-up, so like for instance, the minoxidil and finasteride, you're going to need to keep using it in order to maintain the hair growth. And some people, at first it's like, yeah, I want to stop this, I want to get on board with this treatment, and then it's like, man, this is more than I really want to do for the rest of my life. Maybe I prefer to just accept it as it is. Right. You know, everybody's going to be different. And then your regular checkups just to see if it's working and to monitor side effects, make adjustments in your dose. And then, of course, we're always going to go back to your healthy lifestyle. You're going to need to maintain whatever helps you get to the hair restoration or growth. And that might look different. Maybe it's not going to be as thick as it was. It might not be as dense or have as many follicles growing out hair as you had before. And then healthy hair practices is going to be a huge part of it, depending on the cause of your hair loss, too.
So we want to thank you all for sending in your questions regarding hair loss. So we wanted to take the time to answer the top 10 questions that we received and kind of we gave you a lot of information, but we want to give you short sentences and some takeaways that if you are experiencing hair loss and you have a very specific question, we want to give you a short answer to that question. So some of this we've talked about in this episode, but just to kind of drive it home for us. So the first question is, what causes hair loss in men? So our response to that is hair loss in men is primarily caused by genetic, hormonal changes, medical conditions, medication, and lifestyle factors. Just to repeat, androgenetic alopecia or male pattern baldness is the most common type.
Yeah, and that smoking's going to be a big part of that lifestyle. And stress, because I think men have a lot on their plate. Is hair loss hereditary, or can you get it from your family? Yes, genetics play a significant role when it comes to hair loss. If your family has a history of hair loss or baldness, you're more likely to experience it. And I believe, so I'm female, so really I'm supposed to look at my maternal grandmother, I think, in terms of if I'm going to even experience it.
Right. Yeah. I think it skips a generation.
Yeah. Well, I think it's the opposite gender.
I'm not a genetic expert.
We'll get back to you. The next question is, can stress cause hair loss? So as we mentioned before, yes, stress can contribute to hair loss. Conditions like telogen
effluvium.
Thank you. Where the hair falls out after a stressful event, and other stress-related hair loss conditions can occur.
So what treatments are available for hair loss? Treatments include medications like Rogaine and finasteride, hair transplant surgery, laser therapy, and some natural remedies. Effectiveness varies from person to person. I think that's a key point to drive home.
Yeah.
What works for your cousin may not work for you, may not work for your brother, may not work for your dad. So it's important to contact your primary care provider to find out what works best for you.
Yeah, and they're doing a new thing right now too for the hair restoration. It's called. Oh man, I'll have to find it. Oh, let's see. Micropigmentation. So I think they're using like a little, like kind of like permanent makeup.
Yeah.
I think
like they do for your eyebrows.
Yeah.
Yeah.
Mhm. Scalp micropigmentation. And so there's a dermatologist right here in Maryland named Shoshana Kindred. She has a clinic. She's a dermatologist, board certified dermatologist with her dermatology clinic. But within the clinic, she's also housed a hairstylist.
Oh.
And so because like you do see your stylist so much more frequently. You have a great relationship with them, and they care about what bothers you, and they want to see you live a healthy and happy life with the head of hair that's possible. And so I think it's the best. You get your hair done. She sees there's a problem. You just walk over there, and she can diagnose you off your treatment option. So we have her information in the description box. How effective are the hair loss? So it's going to depend on the treatment, your individual response. The medications like minoxidil and finasteride can be effective for many men, but the results might vary depending on your side effects. And age, I would think age has a big part. And how long the hair loss has been present at the time of treatment.
Right.
Can diet and lifestyle changes prevent hair loss? So a healthy diet and lifestyle, that smoking cessation, can improve overall hair health, but they may not prevent genetic hair loss. So nutrients like vitamin A, C, D, E, zinc, iron, and proteins are essential for healthy hair growth. So we definitely like to push the healthy diet and lifestyle, just living a healthy lifestyle in general. This will greatly help prevent hair loss. However, if you do have the genetic risk factor, we still want you to follow that healthy lifestyle, but you may still be more at risk for hair loss if you have a family history of it.
And as Kimberly said, eat your colors.
Yep.
Oh.
Yeah.
Is hair loss reversible? So we did talk about this a little bit. Some hair types, some types of hair loss can be reversible if treated early, such as hair loss due to stress or nutritional deficiencies. Genetic hair loss is generally not reversible, but its progression can be slowed.
And then someone wanted to know the difference between hair thinning and baldness. So the density, so it could be the number of follicles that you have, or the number of follicles you have with hair coming out of it, that determines the density. And so the fewer of those you have will be thin. So like if you have, hair that you can kind of pull out and see through it, it might be really dense down here, and at the ends it might start to be thinning out too. That's usually associated with your styling practices, whereas the baldness is like there's actually no hair follicle coming out of there, and so that would be the difference of that.
Are there any side effects of hair loss treatments? So yes, some treatments can have side effects. For example, finasteride can cause sexual side effects, while minoxidil can cause scalp irritation. It's important to discuss these with your healthcare provider, as there are many options available. So if one is not working for you, they can always try a different option.
And for that one, it might just be like maybe you can't start it every day.
Right.
Maybe you just take it a couple times a week and then just kind of slowly build up to reduce your risk of irritation.
Absolutely. And our last question, number 10, when should I see a doctor about hair loss? So it's advisable to see a doctor if you notice sudden, patchy hair loss, or if you are distressed by your hair loss and you want to explore treatment options. And as we stated, early intervention can be beneficial. So the sooner you say something, the sooner we can get you on the path to restoration.
And as we've recently been doing in our episodes, we want to make sure that we're addressing vulnerable communities. So in this episode, we discussed who hair loss usually affects, which is, well, it affects both men and women. This episode was more geared towards addressing hair loss in men. Also, did we touch base on age? Yeah, typically older men, or as we age.
But I think if you're really young and you're having hair loss, probably going to stay away from those medications first and look into some other causes.
Right. Race, we didn't touch. I mean, hair loss affects all races. Yeah, especially with I guess with the hairstyles. As far as the hairstyles are concerned in the African American community, it tends to unfortunately have a lot of tension on the hair with those styles, which can contribute to hair loss. Socioeconomic or LGBTQIA community, we didn't really, it affects everyone. I would say.
Yeah, I'm trying to think if there's any options that vary. Yeah, I don't think
No.
so.
No.
Socioeconomics. We didn't really touch base on that either.
Well, actually, for the LGBTQ community, depending on your identity and if you've had any gender affirming treatments or not,
Oh, yeah.
the kind of hair loss you're experiencing, the treatment options that are available, your provider would want to know that, especially if it's gender specific.
I see.
And if you're taking hormones.
Yeah.
Because that could change.
Yeah.
Yes,
You know.
very good.
Yeah.
Yeah.
And then multilingual. Well, as always, if you know, hopefully a lot of what I've noticed is that a lot of healthcare systems offer translation services, so that's very, very important. If English is not your first language, it's very important to you can actually ask for translation services as well. So you just want to make sure that you're understanding what's going on, as well as understand what you are supposed to be doing as far as your treatment is concerned. So,
and I think it's easy to just let your family members speak for you, but a lot of times there's some medical jargon, medical language that's being relayed, and it's really recommended that you have a medical professional licensed translator provide that information.
Yeah. And then sensory deficits, hearing loss, blindness, same thing. A lot of healthcare facilities or systems offer services that help this population, whether they have like different iPad systems or not necessarily iPad, just systems in general that they can get that group the help or services that they need.
All right. So today we discussed hair loss in men, different types of hair loss, as well as risk factors for hair loss in men. We also discussed different treatment options and potential complications / risks from hair loss treatment. As always, reach out to your primary provider if you are affected by hair loss. They can discuss treatment options with you and direct you to a specialist if needed. So, as always, you can connect with us. You can email us your questions, and you see we answer them, or your show ideas at tmi.melanin@gmail. If you haven't already, subscribe to our YouTube channel and follow us on every social media platform. Say hello in the comments when you get there. Please share the show with your friends, rate the Apple Podcasts and Spotify, and leave a comment. It really helps the show get more support and get the message out there to those who need it. You can find all of our social media links and a list of resources related to our conversation today in the description box. We release a new show weekly on TMI Sundays at noon on YouTube and all of your favorite podcast apps. Follow, like, and share our content with all of your friends. Thank you for watching.
Bye.
We'll see you next time.